Welcome back to ABC 7 at 4. March is National Colorectal Cancer Awareness Month, and here to help us better understand the disease, ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health. Now, Dr. Alozie, colorectal cancer, serious problem in the U.S. We know it claimed the life of actor Chadwick Boseman.
Yeah, unfortunately.
What are the odds for men and women to get the disease?
You know, it's kind of hard to really dissect the odds. I think of it more as about 150,000 people a year are diagnosed with colon cancer. It's actually the third most common cancer, right? Lung cancer is more than that. And, you know, when you really look at men and women, their odds are about the same, 1 in 23 to 1 in 25. What's remarkable is that, and this really speaks to the change that we've had in society, is that the risk for people born after 1990 is actually greater than those that were born after 1950.
Wow. And like many other diseases, there is a racial disparity with colorectal.
Absolutely. But for one of the few times when we talk about a Hispanic or Latino population, they actually have less of a risk in terms of incidence and death than Caucasians and African Americans. I will say one thing about this, though. This is not necessarily a racial issue. It's an access issue. In cities like our own, and we'll talk about resources later, it's really about how quickly do you get diagnosed, and then how quickly do you get care after you've been diagnosed. When you're diagnosed early, across the board, people have the same outcomes.
All right, so what are the risk factors involved with colorectal cancer?
Yeah, so I divide this sort of illustration into two sides. The left side is the stuff you can't control, right? What you are, I can't change my skin color, or my genetics, or my hereditary makeup. But the six on the right are really critical, right? You really got to think about age, right? You can't control age, but as you get older, you got to engage with physicians more. Think about being healthy and not drinking as much alcohol. Smoking is huge. Being overweight is another one. And we're going to talk about screening, which I think is critical.
And early detection, a key to prevention.
Absolutely. So I really break this down into three buckets, right? It's 45 to 75, and these guidelines have actually changed over the last 5 years. It used to be 50 and above. And now, if you're between 45 and 75, you should really get a screening. The question then becomes, do you do it once every 10 years, or do you once a year? We'd segue to that next.
All right. You know, you're looking at all the screening here. First of all, colonoscopy.
Yep.
Oh boy, I love those. I love that prep, I tell you. But you know, there's the two-step test too.
Yeah,
isn't there?
And you know, this is more personal preference than anything else. I personally got my first colonoscopy when I turned 45. It was a one and done. Thank God it was clean, and I don't need another one for another 5 years when I hit 55. There's some people that are afraid of that. Either it's the anesthesia or the invasive nature of it. There's actually some data that shows that a colonoscopy may not be as good as having a flex sig. There's some imaging tests. The problem with that is you got to do it every year, and then you're eventually going to get to colonoscopy if it is positive.
And then, of course, you've got the stool-based test, the Cologuard that you see advertisements for all the time. Is that better than the colonoscopy or no?
You know, I think the better is not necessarily that. Again, it's personal preference. I have patients and I have friends and clients who just don't want to have a colonoscopy. And so every year they get the package in the mail. In fact, my mom did the Cologuard, right? She sent off her sample in the mail. It was kind of weird, but she sent it off and she'll do it every year.
All right, lastly, plenty of resources and information for screening here in El Paso. Now, I'm not familiar with Success.
Yeah, the Southwest Coalition for Colon Cancer Screening. What's really cool about this is that they will assess you depending on your age. You must have a Texas address, and insurance status doesn't matter. You could never have had colorectal cancer. Obviously, you should be getting treated at that point in time, and you need to be up to date with some screening. Across the bottom, you see essentially every hospital, every major healthcare organization in the community does the screening. But again, I think here's the key. If you're between 45 and 75, is it a pain? Probably. Yeah. But it can prevent a lot of hardship and morbidity and mortality down the road. Take advantage of the resources that we have.
Gotta do the screening.
Absolutely.
ABC 7 medical contributor Dr. Ogechika Alozie, thank you so much.